Welcome to Vets Talk, the veterans' take on our world today, fair, unbalanced, and courageously honest. I am Dr. Scott Magill, Executive Director of Veterans in Defense of Liberty. I also have a master's degree in healthcare administration, and I was fortunate to spend 30 years of my life as a practicing physician. I had the distinct privilege of bringing some 9,000 new souls into this world. I know the inside and the outside of healthcare. I understand what leads to good healthcare. After 7 years of Obamacare, we seem to be convinced that it's the federal government's place to provide healthcare. Once this belief is firmly established in the American psyche, we are condemned to socialized medicine. Socialized medicine, which will at some point degrade to a single-payer system. Now that both parties are supporting this atrocity, how do we expose the truth? How do we expose this con? How do we prevent it? There is a simple American solution for today's government-caused healthcare crisis. And we invite all conservative Americans to stand with veterans in defense of liberty as we call upon President Trump and the Congress of the United States to stand strong and do not only what they promised, but also do what is right. Repeal and replace the Affordable Care Act.
It's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
This is not only mandatory of men of good character, it is much less complex than we have been led to believe. First, though, how did American exceptionalism create the greatest healthcare in the world? The answer is simple: through the free market. When free market capitalism recognized that the primary parties in healthcare were the patient and the physician, and it prescribed that insurance companies compete for the patient's dollars, the result was exceptional care for relatively low cost. Only when the insurance government hospital complex became involved did we wind up paying exponentially more for only marginally better care. Marginally better care at best. Now we have two choices. One, remove the collective from the patient-physician equation and watch the cost decline and quality rise. Or two, allow the complex to continue interfering with healthcare, leading to inevitable systemic failure. Think about it. Only with the advent of Obamacare did government play any significant role in our personal health care. Imagine, for over 200 years, America's received the greatest health care on the planet at a reasonable cost without the hypocrisy of government. And now our House and Senate behave as they have always been involved in health care, and that they must continue intruding in this most personal aspect of our lives, our health care. This is a bogus belief. This is fake news. Article 1, Section 8 of the United States Constitution, the enumerated powers, sets forth the authority of Congress, but provides no accommodation for government to participate in the healthcare arena. The first act Congress must take is to repeal the Affordable Care Act. Congress must honor their pledge while recognizing and respecting the truth of the Constitution. Repeal does mean repeal. It does not mean modify. By definition, means to revoke, to rescind, to cancel, to reverse, to annul, to nullify, to declare null and void, to quash, to abolish, to vacate, to abrogate, and to recall. It is an unequivocal term. and Obamacare can easily be repealed virtually with a one-sentence bill. Once repealed, Congress should formulate legislation to allow the free market to work in favor of the consumer by increasing healthcare quality and decreasing cost. As an interstate commerce issue, the sale of insurance across state lines would constitutionally augment the free market. National legislation would help provide incentives for state insurance commissions to adjust their rules and regulations, enhancing the insurance market free access across their respective state lines. This will be using the congressional power to regulate interstate commerce in the most positive way for the greatest benefit of all Americans. Additionally, Congress should support the development of patient co-ops. Through such large co-ops, Americans will be able to reap the benefits of the economies of scale provided by the free market. This will not only regain our ability to choose our own physician, but also to purchase insurance that best suits our individual needs, unencumbered by the arbitrary restrictions placed upon us by our government and the insurance companies. The Commerce Clause under these principles may be best used in reestablishing the free market into the American culture. The free market and the improvement of American health are both legitimate and constitutional. In regard to the necessary and proper clause, Chief Justice Marshall wrote in McCullough versus Maryland, "Let the end be legitimate. Let it be within the scope of the Constitution, and all means which are appropriate, which are plainly adapted to that end, which are not prohibited, but consistent with the letter and the spirit of the Constitution, are constitutional." Decades of increasing complex government controls has made our healthcare system more expensive and less responsive, and it has set it on a path to inevitable failure. By applying the American values of free choice and free markets, Congress has the opportunity right now, at this moment in time, to restore control of the healthcare system to the consumer, to the patient. And the governance of healthcare decisions will be returned to its proper position, the relationship between patients and their physician. If our elected officials do anything less than to return the free market to the healthcare system, we must be suspect of their motives. This is such a simple solution, even Congress should be able to understand it. And I call upon you, stand with Veterans in Defense of Liberty. Call the White House, call both your senators, call your congressmen, and tell them, return health care to the free market. Tell them to do what they were elected to do and why we all turned out at the polls in November 2016. We didn't turn out for them to continue meddling in the healthcare market. This has been Vets Talk, fair, unbalanced, and courageously honest.